All right, here we go. I'm gonna go back to sharing and feel free to jump in and stop me if you have any questions or you want to add anything. That's totally fine.
Okay.
All right, so, and then this is a quote that I really like that's sort of, it does relate to what we're going to
Okay.
talk about tonight. There's a big gap between pregnancy and parenting. It's called parenthood. We need more preparation for it and more support through it. And that quote is from Becoming Us. So my kind of philosophy, like I mentioned to you, education is power. And my goal for all the families that I serve is for them to be able to make best decisions for them, their families, and their baby. So this is just kind of a little inspiration that I thought was really interesting. And then, so we're going to be, like I said, covering some immediate postpartum. What does that look like for mom, for baby? And then some just fourth trimester changes for mom.
Okay.
And then some breastfeeding and just overall newborn care.
Okay, that sounds good.
All right. So, what does the immediate postpartum period look like? So, just like in actual labor, there's also stages for postpartum. So, this is the time when baby was just born. What happens after that? So, first thing I wanted to just touch on is a lot of hospitals do this routinely now because there's a lot of evidence backing it, but I don't know if have you ever heard of delayed cord clamping?
Um, no, I read something like they either cut right away or they wait until it stops pulsing
Yeah,
or something like that. And I just was like, oh,
exactly
maybe they
right.
just wait so it doesn't bleed out, or I don't know.
Yeah, so like let's say 50 years ago, what was routine was baby was born and the cord was cut. However, now it's become more and more common to cut the cord, like you mentioned, once it stops pulsating, because, and this is really interesting, the baby can get up to 80 milliliters of this precious blood that's connected to you if we allow the cord to stop pulsating first. So I thought that was really interesting, the 80 milliliter part. And then so that's the evidence behind like delayed cord clamping. And then APGAR score. This is basically just a way that a newborn is evaluated, and I'll show you the chart in the next slide. But this happens at minute 1 and at minute 5.
Hold on, I have a question.
Yeah, of course.
So, how long does it take for it to stop pulsing?
It can be 45 seconds, it can be 1 or 2 minutes. It's never really a long period of time.
Oh, okay.
Yeah, like you don't really even realize the time going by because at that point, like baby's being brought to your chest. So
Right. Yeah, there's a lot going on.
yeah, it's usually just a matter of about a minute. So yeah, it's just allowing that the rest of that blood to go to baby.
Okay, I wrote that down.
Yeah, and I can also share these slides with you too, so you don't have to scribble frantically. So yeah, APGAR score is basically just how is baby doing, and I'll show you on the next slide what that evaluation consists of. And
Mhm.
usually if the baby doesn't score that great at minute 1, usually the score gets much better at minute 5, because at that point oxygen levels
Mm.
are, increasing, and so that usually goes up if it's a little bit down. Some just typical newborn procedures. These can also be refused, but you need to check out what your hospital's laws are. So there's the erythromycin. This is referred to as the eye goop. And so, yeah, it's just basically an eye cream that babies get.
Oh, I've noticed that. Okay. I always wondered why they looked like they had Vaseline on their eyes. Okay.
Yeah, it actually does block babies' vision, which can obviously interfere with breastfeeding if they can't see what they're doing. So some people do ask if that can be delayed breastfeeding until the first feeding has happened.
Okay.
But if you don't mention anything, then these things will just routinely happen right after baby comes out. Um, Vitamin K shot, and then the Hep B vaccine.
So what is the purpose of the erythromycin?
That each of those three procedures have different purposes, advantages, and disadvantages. I can send you more information about that because that's a whole like another topic. Um, the erythromycin eye cream, that is specifically to help prevent blindness.
Oh, I'd probably let my kid have everything. I'm not like I don't say like anti-vaxxer, but like
Yeah.
just have it all. I'd rather him be ready to go and then something happened and I feel bad because I said no. You know what I mean? So
Yeah. And then importance of skin to skin. I don't remember if this was on your birth plan or not, and most hospitals do recommend this as well, which is great. Um, what's so amazing is the way the body was made. So just putting baby on mom's skin right when he or she is born, it increases oxytocin levels,
mhm.
which is the natural, love drug that your hormone that your body
Yeah.
produces. And also it helps get all of mom's healthy bacteria on baby. And then also it's basically a natural warmer. So baby will stay warm. Your breasts can what fascinates me is your breasts can actually be different temperatures depending on that part of the baby and his or her temperature. So, and it also has amazing benefits for mom. So, I wanted to mention skin to skin, and then there you might have seen that like whiteness, that white
Yeah.
of cheese
Cardi said that they wait 12 hours.
for the first bath.
Yep.
Okay.
I thought that was fine because I know like it helps moisturize their skin, but then like protects them from like bacteria and stuff. And I was like, oh, that's fine. But I have a question about skin to skin. So does it always have to be like mom to baby? Like, so because I was thinking too, I was like, well, I've carried Nolan for 40 weeks. Couldn't I just let Carl hold him for the first time? Like my boyfriend?
There's definitely skin to skin can definitely be with you and then also your support person. For if you're wanting to breastfeed, skin to skin is very important that it's you for the first time. But then, if you want to say, like, we'll do skin to skin for the first hour, get that first initial breastfeeding going, and then your boyfriend will hold him, that's a great idea.
I just feel so bad because it's like he's gonna see him and he won't be able to hold him.
Oh, no, it's not
No.
like you can't hold him. It's not like
Okay.
that. It's There's a lot of benefits to skin. So it's not a you can't hold him right now. And there's
Oh,
so much happening in the moment that it's going to be it's going to feel like all these emotions, what is happening, and so it's very important for your body to stabilize you for baby to also be there.
okay. Yeah, because I was thinking like, oh well, I might as well just like push the baby out, hopefully, and then like get the placenta out and make sure I'm okay. And then while the doctors are still tending to me, like Carl could hold him. That's what I thought. You know what I mean?
And depending on the situation, like sometimes moms will have tears and they'll need to be stitched up. And so sometimes if mom is feeling like I need to just like drink and catch my breath, then for sure their partner will hold the baby. Like you'll just kind of see in the moment, but
Okay.
for sure.
Because I think I wrote that in my birth plan. I think I said um like I'm okay with it, but if possible, I would prefer my boyfriend to do it first.
Hmm.
So okay, good to know.
And then that, like the vernix, like we just mentioned, that you can
Mhm.
also see in this photo here. So Yes, there's a lot of emotions for mom. Lokia is the discharge that's going to be occurring right after postpartum and then, weeks after. And we'll talk more about that on the postpartum slide. And then something that I do like to let people know about is after birth, your nurse will be letting you know that your nurse or sometimes the doctor will do the uterus massage. And it's called the massage, but it really doesn't feel like a massage. And basically, they are going to be moving around your, like pressing hard on your stomach.
Oh,
And this is going to be massaging the fundus area, and that helps to prevent hemorrhaging and just to make sure that everything is contracting back down. So
gross.
that is painful, but definitely after birth, that puts things into perspective. So,
Oh my God.
if you, like your doula or support person can just kind of hold your hand and help you breathe through that. And then, some shaking, hunger, thirst, that's all normal.
I read, and
Right.
you sweat a lot too right away. I read like as soon as you like give birth, you start like sweating bullets. So
Yeah. Or you can have like the shakes and be really cold too. Your body's like your
an
hormone.
adrenaline dump. Yeah.
Yeah, for
That
sure.
makes sense.
So interesting. And I put this picture here just to talk about jaundice. Have you ever heard of that?
I know it makes you yellow and it has something either to do with like your liver, your kidney.
Liver. Yep. So baby is stabilizing in terms of the liver levels. So it is pretty common. It occurs in 60% of full-term babies.
Wow.
And the most common form of jaundice, there isn't really a treatment. It just takes time and some observation from the hospital staff.
For what? So their liver starts to kick in pretty much. So they're just yellow because their liver hasn't really started working.
Yep.
Oh,
There's a word called blubberin or something like that, and I'm not 100% sure how to pronounce it, but there's an excess. So the body's just trying to regulate that out
oh, okay.
and
That
look
makes sense.
kind of tan.
Okay.
Yep. And then here's the APGAR scoring system that I mentioned. So right when baby comes out, you might hear a nurse say, he's in 9 out of 10, for example. And so this is what that means. So they're going to evaluate baby on activity, pulse, grimace, so reflex, appearance, color, and respiration. So the reason I like to bring this up is because if baby's doing, relatively well, it'll be like a 7 to 10 score because each of these get 2 points.
Mm-hmm.
If baby needs some extra attention, usually the score is 6 or lower.
Okay.
So that's when, you won't be able to do skin to skin, but
Oh.
this chart is really helpful for that.
Wait, how would they know though? So like as soon as he comes up, they like look at him that fast and they know?
Yep. So
Holy
all
cow.
of these, all of these like procedures, most of them can be done right when, like right on you. So baby doesn't have to be weighed right away. You can say, right now we're going to try to do the first feeding and we're just like enjoying being together, doing skin to skin. So like the height and weight and all that can wait.
Mhm.
Even these 3 procedures here, you can tell them, we're going to do that after the feeding. And then the APGAR, that test can be done right on baby.
Yeah, you
Right
said
on
1 to 5 minutes it takes. Okay.
they're doing it 2 times at the first minute and at the 5 minute one baby comes out.
Wow. Okay.
And so that's just to make sure, like, okay, if the initial score was 8 out of 10, oh, now it's 10 out of 10, so baby's doing great in terms of breathing, for example, if that was an issue.
What? Do you need something? You're gonna watch or listen?
Yeah.
What about, are you making the cube first?
Yeah.
Oh, and then you haven't made the rice yet?
No.
Okay. We're just learning about like when the baby comes out, there's like a score. Where are you going? Oh, there's like a score. And depending on like the response maybe gives, like if he cries or if he moves his arms and like the color.
Okay.
So if it's like it's over 7 to 10 is like the highest, that's good. But if it's like under 7, then it's not good. And then they usually wait a couple more minutes to see if he'll start like coming around. And then they do that the first evaluation at minute 1, and then they recheck them in 5 minutes.
I get it. I don't want to interrupt.
No, I'm just explaining to you like what you just said.
No, you're not interrupting. Nice to meet you. What's your name?
Carl,
Carl. Nice to meet you, Marcella.
good to meet you.
Welcome. All right, so we'll jump back in, and like I said to Iceland, if you have any questions, feel free to jump in and stop me at any point. All right, so you have 3 trimesters during pregnancy, right? And then the whole postpartum recovery time is referred to as the 4th trimester. So I like to put this funny picture in there because it's kind of a, you know, Instagram versus reality or whatever you want to call it. Some people think that postpartum just looks like this, and sometimes it has those moments, and then other times it's just you wearing a diaper. And that's great too. I mean, you won't be wearing a diaper the whole time. Usually it's just the first day or two when you're still bleeding a lot. So, like I mentioned earlier, the lochia is the vaginal discharge. So, in the beginning, that will be really red. And then it will turn slowly paler, like day 2, 3, 4, and then it'll go more white. And that's just your body getting rid of all of the cells in your, like the excess blood. And I do like to touch on this just because a lot of people, you take a class or you read books or you watch videos on labor, but we don't really talk about, well, what happens after baby is born, right? And that whole like parenthood, like I mentioned. So this, like the first, several months, you're just going to be recovering, getting to know your body, getting to know your baby. And so some factors that will really help this process will be just overall health, emotional health, physical, mental. You can't care for your baby unless you're taking good care of yourself. So self-care, whether that looks like a warm bath every few days, once you have more mobility, taking, short walks, that's great too. And then the importance of support. I know you mentioned having family around, so that's going to be really, really beneficial. Rest, and then the more contact you have with your baby, the faster you'll actually heal and your hormones will level out. So it's amazing how that's made, like you just gave birth, and then the two of you together will actually help each other adjust in terms of hormones and healing.
Yeah, that makes sense because like my friend Mariah with her first kid, she said that she didn't even want to hold her baby. And then later on she said she regretted it. Not like holding him more. So that makes sense.
Yeah, it's so interesting. And then I have a resource list that I can pass along to you that, like, if you're looking for a lactation consultant, for example, or a support group for X, whatever it is, I have that put together that I can send you. And then also there's different mood disorders and different possibilities of postpartum. There's, the baby blues, which used to be an actual like diagnosis, but now it's becoming more and more common to just say everyone experiences baby blues, because basically what that is just you cry at the drop of a hat. And this happens, towards the end of pregnancy as well. I'm sure you've noticed. Or just like I'm unexplainably sad, or like you watch something and you're just like, wow, I'm really emotional and I'm crying over a commercial or whatever. And so that's really, really common. And I just like to point that out and say, you're not experiencing postpartum depression just because you're emotional or you're sad, or, you have really, you have some highs and you have some lows. That's all really, really common. So I like to point that out versus there is something called postpartum depression, postpartum anxiety. And, I like to mention the resources on that because it is helpful, especially for you, Carl, to know like what are the signs of that. So then you can bring in additional help if that is necessary. And then that is also very different from postpartum psychosis as well, which is feeling like you want to hurt yourself or hurt your baby, which is a lot less common, but does happen. So
Yeah, that's what our doctor told us because I like expressed to him that I was worried about getting like postpartum depression or something because I have anxiety. And I said, what about like when you go crazy? And he's like, it's really not that common. So I was like, okay. So that took some of the edge off.
yeah, definitely. And there is no shame around any of these things. If, a lot of people need extra support, and that's totally good. That's totally normal. So knowing the difference between, something more like baby blues and something like postpartum anxiety, knowing the difference between those is a really good thing because then you can get the support that you need.
Okay, that's good.
So, a little so this is a fun game to do in person, but since we're not in person, so in person you'll like I would like pull things out of my bag and you would be guessing what they're for. So because we're on Zoom, this is a little bit different, but I just put some pictures here of what's in my bag if I were to come to your house as a postpartum doula, for example. These are some things that I would maybe bring with me or suggest for you for the postpartum period. So, what do you think I would bring a pad for example, this pad here?
I have that. It's an ice pack, the makeshift ice pack, and you put in the freezer. I don't know if that's lavender or what, but I have witch hazel and aloe already, and I have maxi pads. Um,
That's exactly it. Padsicles, as we refer to them. So that can be really, really comforting in the postpartum period. Like you mentioned, pad with witch hazel or whatever else, you want to put on it. A lot of people benefit from nipple cream, after feeding, if you feel sore or just, need some additional healing, that's helpful too. And then what do you think about a squatty potty or a stool? What could that be used for?
well, I have one. It helps you poop.
It does. And then what about specifically for postpartum?
Like maybe it helps you clean yourself better with the squirt bottle.
Yes. I actually forgot to put that picture on here. Um, the squirt bottle is super, super helpful for cleaning. Definitely the first week or two, for sure.
That one and like the stuff you put on your vagina too. Um, I forgot what it's called. It's from Frida though. Like I got the squirt bottle from Frida, and then they have like this thing you put on your vagina to help you heal.
Is it like a gel or?
Perennial spray.
Okay.
Oh, okay, that's fine.
Yeah.
You can come back if you want. Yeah, I have that. And then I bought nipple cream. I forgot the brand, but it's one of the brands of the breast pump. And because I bought it because I read and it says like if you put nipple cream before and after, you don't like basically chap, like your nipples don't chap as bad as if you just do it after or like once in a while. So that's all I know.
Yes. So the squatty potty or a stool, what that helps with is hemorrhoids are pretty common after you give birth. So that just helps you to not be pushing as much afterwards.
Mhm.
And then the others are, pretty self-explanatory. Motrin is really great. Just pain relief if you are feeling like you have a headache or, cramping. Motrin is one that is suggested and it can be okay for breastfeeding moms as well. And then just taking the time for yourself, warm bath, whatever
Yeah.
it looks like. All right. Any questions now
Oh,
that
and also bought like a wrap on, well, I didn't buy it yet, but it's in my Amazon cart.
The wrap?
Yeah, well,
Here.
it's
I'm adding here in my notes, the Perry bottle is what it's called, that squirt that you were talking about.
yeah. But this one's nice because like it's not like the hospital one where you just have to shoot it. This one has like a little notch or something. So it'll just squirt up when you tilt the bottle. This is what I got. Or what I put in my cart.
I have to send that to me. I can't see it that well. Is it a sling or a wrap?
It says 2-in-1 postpartum support recovery belt wrap.
Oh, belts. Okay. When you said wrap, I was thinking for baby. This is for you.
Yeah,
Okay.
I sent it to you.
Great. I'll check it out.
Oh, and then also too, they told me after ease.
Is that the gel or cream that you were talking about?
No, I guess this after ease, it's supposed to help, like you ingest it like with water or something like that. And it's supposed to help with cramping, postpartum cramping.
Okay.
I don't know. My friend told me to get it.
Nice. All right. So, any questions before we transition into baby?
No, I'm okay.
Okay. All right. So, feeding baby, there are a lot of ways. It's not just bottle or breast. There's also syringe, cup, spoon. Or if you,
Oh,
yeah, you've probably
yeah.
seen videos. The importance of breastfeeding, I do like to touch on this because it's so important. I think this image helps just to visualize it. Breast milk has more of the good things baby needs. So that's all that breast milk contains versus formula. Formulas have become way better than they were before, but
Yeah.
it can't compare.
Yeah, I read that like when you're sick or the baby's sick, through the like the saliva and stuff, your color changes.
Mm.
Your breast milk, the color changes depending on like what the baby needs or if you're sick or something, because it's giving that extra good stuff to the baby.
All those antibodies.
Yeah.
For sure. And I've included some just, facts down here that I can also share with you. It reduces SIDS for the first 6 months, which is a really common concern for a lot of parents. Benefits to baby, reduced risk of ear infection, leukemia, type 1 diabetes. Benefits to mom, reduced risk of so many different types of cancers, um, less hemorrhaging, and just also overall increased bonding and hormone and just better hormones.
I have a question. So like when I took the infant CPR class, I don't have it right here, but they said that like you should wait 4 weeks before giving your kid a pacifier so you could establish breastfeeding. But then they said like you should give your kid a pacifier at nighttime because it reduces SIDS. So I was like, I feel like that's kind of contradicting.
I think you would need to do your own research in terms of where you are planning on sleeping, where you're having baby sleep, what that will look like if you're, breastfeeding on demand during the night, or if you're just wanting him to, if you're just wanting to put the pacifier in and see if he calms down just with the pacifier. So there's a lot of different factors, and there are differing opinions in terms of do I do pacifier, do I not?
That's what I read because like I read that it is good to give them the pacifier right away because it does reduce SIDS. But then some people are like, oh, it causes nipple confusion. And then other people say nipple confusion's not real. So I'm just like, I don't know. I'll read everything, but nothing's ever like 100%. I feel like it's kind of people put their own biases in the like articles and stuff. So I don't know. I was just going to wing it and see like if I give him a pacifier, will he relax? Will he sleep better at night? And if I can breastfeed, then I can breastfeed, but if he doesn't want to because he's confused or whatever, then I'll just figure it out from there. But I wasn't comfortable picking one or the other because I felt like it was too extreme for me, in my opinion.
Mhm.
I wanted to find like a happy medium because I felt like what the nurse had said when she was teaching the CPR class, like you don't give a pacifier for until 4 weeks. I was like, 4 weeks? That's a long time.
Mhm.
So that was too much for me. Like if it was me, I would just pop it day one. There you go. So
Well, there have been some there is talk about that having disadvantage too. So maybe I can send you, if you want to write a little list of things that you still are wondering about, I could send you some texts and literature on that.
yeah.
And then I listed here different newborn and baby reflexes. I'm not going to go through each one, but they're all like those reflexes are all there for a reason, and you'll see those on a daily basis. Um, Early feeding cues, I have that picture in here as well, so I'll talk about that when we get to that slide.
Yeah.
Breastfeeding holds, and then proper latch. What does that look like? So we'll talk about that on these slides as well.
Okay.
So this one is just in there for fun. What a breastfeeding mom's boobs mean, which I think is I love the drawings too. I think that illustrator is great. So like your hips don't lie, your breasts don't lie. So breasts feel soft after feeds. The nipple should appear unchanged, so it shouldn't be white or pinched. And then also breastfeeding should not feel painful. So the first few sucks in the first few days, it's going to be a learning curve. It's going to be an adjustment. And this is where I like to refer again to lactation consultants because they can be a great help, especially before you even leave the hospital. But it shouldn't feel painful. So if it is, that could mean a tongue tie. It could mean bad positioning. So that's when like seeking additional help is beneficial.
Yeah. But I also, when I was reading on like lip tie and tongue tie, oh, could you go back?
Yeah, of
Okay.
course.
They said that sometimes like it's really hard to find a pediatrician or like a lactation consultant to diagnose it because I guess it's something that's easily overlooked. And then the doctors and stuff are more likely to place the blame on you that you're not doing a good job of guiding the baby to the breast. And then women will say, like, oh, because my baby has a lip tie or tongue tie, because the way their mouth is shaped, it's hurting when they're feeding from me.
Hmm.
But that's what I read. So I just thought, okay, well, that's good to know because if it does happen to me, or I feel like baby's not drinking enough, or like their mouth is hanging off weird, or something like that, then I would make an effort to find a good doctor and then keep advocating for the baby because even now as an adult, like I've been pushed away so many times by doctors or they like dismiss your feelings or your symptoms and stuff. And it's like a baby can't talk. So it's like I'm the one that has to speak for the baby. So I would make sure. And I'm glad I read that article because otherwise I wouldn't have even known that
Mhm.
you can get lip tie or tongue tie. And they even said to take the baby to the dentist too. Because if you have a good dentist, they'll do the operation for you if they don't catch it at the hospital.
Mm,
Oh,
yeah. And now those are a lot done through laser too. So it's not a really painful or difficult procedure.
okay. Well, that's good to know. I didn't know how they did it, but I just figured it wasn't like that painful.
Mhm. Yep.
Okay, you can go on to the next slide.
All right. There's some tips and tricks and videos in here. I'm not going to go through all of them just for the sake of time, but I'll share the slides with you. So this graphic is really helpful to me. Nose on target with nipple, tickle the lower lip or the chin area, and then you'll see the baby's mouth is going to open on its own and then chin tucked. So how do you know is baby latching on well? So at least half inch of your breast around the base of the nipple is in his mouth, and then his nose is nearly touching your breast. So you'll see here in this graphic, the mouth is, has really suctioned around that nipple, and then the nose is just above. So one thing that's also interesting to note is that you'll hear baby swallow, like breathe, swallow, and that will repeat. So suck, suck, swallow, breathe, and that will
Like
be.
you're drinking water basically from like a water bottle. Okay.
That's
That
right.
makes sense.
Yeah. And then these are some positions. What I love, my favorite position, what I like to mention, and that's what these videos cover, is a laid back position, that's really comfortable for you. There's no pressure involved. Your body is relaxed, and baby can kind of just do what he wants to do as well. So these are different positions that you can experiment with. If you have a baby doll, you can start practicing now, and then shortly after birth. These are different ways to breastfeed, but the most important thing is just for you to be calm and relaxed, and then baby will mimic that.
I read a contradicting article that said that why would you breastfeed your baby laying down? Because it was like basically making the comparison that like you don't eat eating down, like laying down. So why would your baby eat laying down? And it was saying that if your baby is more upright when they're like drinking milk, that they won't get colic or like or any like other digestive problems like gas or whatever else. And then it's yeah, basically it's just overall better for their digestive health because everything's falling like this, and I don't know how it would impact the way it falls into the stomach if they're laying down, but I just thought like that's true. Like why would a baby eat laying down when we don't do that? But I don't know.
Hmm.
I'm not a doctor, but that's what I read. So from that, like from these pictures, I probably pick more of like a upright position instead of like completely flat, like me laying on the bed. I probably hold him.
And you'll see here in these videos when I share it to you that the laid back position is still upright. It's just laying on pillows and having pillows around your arms. So you're just leaning back a bit so you're not straight 90 degrees.
Okay. Okay.
Yeah. All right. And then let's see, where am I? Okay. So sometimes a common concern is, well, if I'm breastfeeding, or how do I know that the baby's getting enough milk, or whether I'm breastfeeding or bottle feeding, how do I know that baby is peeing enough or pooping enough? So this is really interesting, little like a little key, and something that's just an easy way to remember it is basically the day mimics the wet. So by day 1, baby should have at least 1 wet and 1 to 2 poops. Day 2, baby should have at least 2 wet and 1 to 2 poops. So you get the pattern. And the hospital will help you start tracking this. There's also some apps so that you don't have to track it yourself. But in the first week, it's pretty common to just track the diaper so that how baby's doing, because you're most of the time you don't have a scale to weigh baby, even though that will happen at the pediatrician's office.
Yeah, I read too that like the first poop looks like tar.
Yes. Yeah,
So I don't know I don't remember how long that lasts for, but like if you see like black poop, don't be alarmed because it's basically like all the amniotic stuff coming out of him.
for sure. That black is going to look like tar, and that's called meconium, and
Okay.
that's the first poop.
Oh, that's what happens. That's like when the baby poops in your belly.
Yep.
Okay. That's what that is. Okay. Makes sense.
Yeah. And so the first poop can also be really sticky. And then, so this applies more to breastfed babies, but by day 3 or 4, it turns more green. And then by day 4 or 5, it looks more yellowy like this.
Hold on, sorry.
Yeah.
Okay, go ahead.
All right. So that's just kind of the diaper progression between the days. So if you notice like, oh my goodness, why are the colors changing so much? That's totally normal. Excuse me. And so it might look seedy at first, and then it will look watery. If you do see any blood, that is something that is a warning sign that you should call your doctor.
Or white, I read too.
Yes.
Poop is bad.
Yep. And then you might be like, okay, I see poop, but how much poop is poop enough to count? And so this graphic here helps to know by day 4, most breastfed babies will make 3 or 4 poopy diapers a day and only count the poopy diapers that are bigger than a quarter size.
Oh.
And then by day 3 or 4, breastfed babies should make 3 or 4 wet diapers with pee that looks like clear water. And then a wet diaper is as heavy as 3 tablespoons of water. So that's why I asked you to just grab a little diaper or paper towel. I don't have a diaper here right now, but just go ahead and scoop some water into your diaper or paper towel, and that will help you to kind of determine, okay, I kind of know what this feels like in terms of weight. So that's an easy way to know that baby's on track, baby's, healthy, he or she is pooping and peeing as much as necessary. Yep. So you can do 3 tablespoons of water, and this is just going to help you to know what this feels like, so that when this happens, you're not wondering or,
Looks like
panicking.
nothing.
So yeah, that's just how it's going to feel like in the beginning. Of course, as baby grows, the peas are going to be a lot heavier.
I see. It is a little bit heavy now.
Yeah. And
Oh.
I don't know if you've seen also an easy way to tell, not in terms of weight, but also that baby has peed. Have you seen the diapers that have that line and the line changes color?
No, I don't know, but I know what you're talking about because my friends will be like, look, and I'm like, what are you pointing at? So I know it happens, but I never know where to look.
So
I don't-
here's a picture here on a dry diaper. The line is yellow, and then that
Oh.
line will turn blue.
Oh, okay.
All diapers have that, but most of them do.
Okay. Well, this one so far is still yellow.
Maybe a little delayed reaction.
Yeah. Okay, well now I know. That makes sense now. Yeah, because
Is that an interesting activity?
yeah, that was now I know. As the mystery has been solved.
Yes, that is called muscle memory. So now you'll know when you're holding the diaper whether, whether that's an actual pee or not.
Good to know.
Um, and then backing up, so we talked about diaper counts, and then here are some cues. And the goal is to not allow a late cue to appear before we begin feeding. So early cues are going to be, you've probably seen babies do this before, like stirring.
Mhm.
We see that rooting,
Oh no, that's when they're tired. Never mind.
the rooting reflex, and then a mid cue of like, okay, I'm really starting to get hungry is like stretching, hand to mouth, sucking. Whereas an earlier cue would just be the mouth opening. And then like I'm really upset now is, like crying, screaming, really agitated movements.
Throwing
So
a tantrum.
yeah, so in that case you don't want to breastfeed when the baby's already in that really upset stage. You want to calm the baby down first and then offer the breast. So that's just helping baby calm down. And then once he or she is okay, now, I'm going to feed you because I know that you're hungry.
Yeah. Okay, good to know. Well, the goal is to not let it get that far anyway.
Exactly. And I wanted to show you, if we were in person, I would pass this around and let you see. But a lot of times when moms want to breastfeed, a common concern is, well, I'm not giving a bottle, so I don't know how much milk is coming out, right? But you always have to remember that your body knows best. And in the beginning, baby's stomach is so, so small that just those drops of colostrum before your milk even comes in,
Yeah.
just those drops of colostrum is already filling baby's stomach up.
Okay.
So, like we mentioned the other night on the initial consult on Zoom, breastfeeding is really supply and demand. So the more you breastfeed, the more baby is on your body, on your breast, the more milk you're going to have. So I like this graphic because, so this is a really small bouncy ball, right? And it's,
as big as a cherry on the first day.
yep. So this is day 1 and it can only hold 1/4 to 1/2 of an ounce. That's it. So that colostrum is already going to fill this up. Whereas by day 3,
Oh,
ping
wow.
pong ball. So it does, the stomach does grow pretty fast. 1/2 to 1 ounce, and that's it. So if you see, a new, like a 3-day-old newborn having a bottle, this, like a bigger bottle, that is
Like
way.
2 ounces?
So day 3, it's only 1/2 to 1 ounce.
Okay.
And then by day 10, the stomach is already getting to be the size of like an Easter egg. So day 10 is when you'll usually see babies transitioning to like a 2 to 3 ounce bottle.
Yeah.
So, and your baby will know when to stop and when enough is enough. So that's amazing because you don't have to worry about that.
Is this what you're talking? Can you see this?
Yes.
Here?
It looks like it's changing color, right?
Let me see. Hold on. Is that too bright?
Yeah, it looks too bright now. I could see it a little bit better when you were closer, but it looks like it's starting to change color now. And I'm sure the warmness of the baby's body helps the color to change as well. Yep, I can see it changing.
Right? Can you see it?
Yeah, I can see it.
Okay. It's like a little blue line.
Yeah, it's
All right.
it's like in the green stage.
Yeah, it's like greenish yellow, but okay, now I know like that it's gonna be somewhere down here. Good to know.
Yep. So I like this visual, so that you know that, because a lot of moms are like, well, this can't possibly be enough milk. Yes, it is.
Okay. Yeah, because do you think like your babies, I think like the problem is like I used to think babies are born with one size stomach, and then obviously as they grow, their stomach grows with them, but I didn't know that their stomach was like this big when the baby's like so big. So the stomach has a lot of catching up to do. I didn't know that.
Yep.
So that's a good visual.
Yeah, and that's why the milk isn't going to be there until day 3 or 4, when
Yeah.
that stomach is already large enough for it.
Yeah.
Yep.
Wow.
And that's another important reason why we do that skin to skin, and the initial breastfeeding is recommended within the first hour after birth, is because that colostrum is called liquid gold for a reason, and it's super important for baby. So that's why it's also recommended that that is established in the first hour. All right, and then finishing up here, I have a couple review questions for you, and then this is just a funny graphic you can read. Many, many boobs full.
Yeah. A billion times per day. Yeah, that's pretty much like what I read is that your baby is going to be stuck at your boob all day, eating all day, or using you as like a pacifier. So
Mhm.
It's
And
true.
in the beginning, you will be nursing on demand, or like you said, just baby here, because that's what they need in the beginning. It's not like you're spoiling him. There's no such thing as
Yeah, I
spoiling,
agree.
So I just think that that graphic is so good because that's probably what you will feel. All right. So review question for you. How do you know that baby is pooping or peeing enough based on the day?
I
And
just wrote in a week, you should have 3 to 4 dirty diapers of pee and poop.
you should be able to annotate right on here. So if you hover over to the top of your Zoom toolbar, you should see a little pencil icon that says annotate. Do you see that there?
Hmm. Oh, yeah.
Okay, so once you click annotate, then you can hold on to the text, or you can draw or mouse, and you can even write right on here if you want. Like here, I can do the first one. So by day 1, if I remember correctly, so now I'm going to think back. We talked about the day being a good indicator of approximately how many, right? So by day 1, there should be at least, and I'll write on here, 1 wet and 1 to 2 poops. All right, your turn for the next one.
I'm gonna say 2W. No, probably the same. I don't know.
Did it pop up on your screen? Because I don't see it on my end.
Yeah. Oh, is it there? Oh, do you see
There it
it?
is. Yep. So
Okay.
by day 2, how many wets should there be?
I just said it would be the same.
So by day 2, there should be at least 2 wet poops.
Oh, wow, that fast. Okay.
That's why I use the day as the indicator of the number. So day 1, there should be about 1 wet, at least 1 wet. By day 2, there should be at least 2 wet. By day 3, there should be at least
2 to 3 wet and 2 to 3 poops.
That's right. By day 3, there should be at least 3 wet. 3 wet and 3 poops. By day 4, there should be at least 4 wet, right? And at least 3 poops. The poops take a little longer to catch up usually, which makes sense because we don't poop as nearly as many times
Yeah.
as we pee in the day, right? And then day, here, let me jot this down too. So day 4, there should be at least 4 wet and at least 3 poops, and then poop will stay the same for 5, at least 5 wet,
Thank you.
3 or more poops.
I rushed the rice a little bit, and then it would just get cold, but it should be good.
All right, and then last slide. Let's
I
see.
wrote that down in my notes.
That will be a good key to have. Let's see. I think I need to get out of here first. All right, and then I need to clear the annotation. Annotate clear. All right, and then what do you think about a change happening in mom and a change happening in baby during the 4th trimester? From what you remember, from what we discussed, what do you think a big change would be in mom?
Let me see.
Do you want to type it in or do you want me to?
I can do it.
Okay, I will
A
present.
change.
You can annotate even if it's not in present mode, right? Yeah, I think so.
Yeah. I put stomach size for baby.
For
And
sure.
then for mom. Um, hormonal change.
A lot happening with the hormones, and we'll talk more about that too during the stages of labor one, because the hormones play such a huge role in pregnancy and labor as well. And then you'll see those hormones carrying into the postpartum period. So, yeah, a lot of your hormones affect your milk supply, affect baby bonding, and there's changes happening in partner as well. So, which I
Yeah.
didn't see on the slide, but yep, those are all very applicable, good examples. And then just let me clear this so that it will let me move on.
Look, this is how heavy a wet diaper is. And it's only 3 tablespoons.
Now Carl can hold it so he can feel too.
Now it's turning more blue.
Yeah, it takes a minute to catch up since it's not in the body warmth, huh?
Yeah, probably. Yeah, if it's blue if it's dirty.
Yeah, you know.
Oh, I did it.
This is just kind of a funny one. There's no organ quite like the uterus. If men had such an organ, they would brag about it. So should we. And then all of these are Ina May Gaskin. She's like my hero. Even if it has not been your habit throughout your life so far, I recommend that you learn to think positively about your body.
That's
And
nice.
we'll talk about like affirmations and the role that they play in labor, which I think that applies to postpartum as well. Like what you tell yourself and what you believe, your self-talk, your beliefs play a big role in, how you feel, how situations end up. So I wanted to just end with that. Do either of the two of you have any questions before we finish?
No, I think I'm okay. I think I learned it was fine because it was not overwhelming. Like I think you gave me just the right amount of information where it's not like too much and then like once we hang up, I'm not going to be like, "Oh my god." So,